I will now be talking about the injuries a runner would commonly face during running. The first and foremost injury would be what we call as the runner's knee. As the name suggests, it's commonly seen in the runners and predominantly over the knee or the kneecap, which is the patella. In the runner's knee, there is a lot of irritation or wear and tear underneath the surface of the kneecap and predominantly affects the cartilage. Who is at risk? Any athlete or any runner who performs a lot of activities that involve excessive bending of the knee, such as squatting or lifting weights while squatting, or excessive activities such as jogging, climbing up and down the stairs. What does it feel like to have a runner's knee? There is usually pain on the undersurface of the kneecap or around the knee joint. There's usually a grinding or a popping sensation at the knee. And of course, as all injuries, sometimes there may or may not be swelling. If any runner has been diagnosed with runner's knee, you need to get rehabilitated for the knee joint in order to minimize the pace at which the wear and tear progresses. Rehabilitation can be either done using a TheraBand or a resistance band that can be bought at any sports store, or if you do not have access to a TheraBand, then you can also use weight cuffs. To begin with, we can try the weight cuff at the ankle and instruct the runner to lift the leg slightly above the surface of the mat. Again, it should be held for a count of 5 and then lowered down. The next exercise is what we call as the static quads. You would ideally place a roll of towel underneath the knee and instruct the runner to press the knee on the hand or the towel. As the runner presses the knee, you need to hold it for a count of 5 and then release it. After this, you can place another roll of towel, or if you do not have the towel, you can place your other hand fisted. This puts the quadriceps at another angle and helps to strengthen the quadriceps at that angle. Again, you need to press the knee down, hold it, and then you will release it. If you are using a TheraBand, you would ideally need to measure the TheraBand from the ankle right up to the knee joint and then tie it around at the level of the ankle. And then instruct to lift the leg up, holding it for a count of 5 and then lowering it down. We usually start with about 5 reps and then progress on to 10 reps, depending on the level of comfort. We will now progress on to what we call as the dynamic quads, where you will instruct the runner to sit on a table where the legs can be dangling down. We will now focus on strengthening of the quads, also the dynamic quads. So basically, you can use the TheraBand. The measurement continues to remain the same. And then the affected leg is taken up against the resistance of the TheraBand. Hold it for a count of 5 and then release it. During the later part of the rehabilitation, once you're done with TheraBand and weight cuffs, you can progress on to strengthening the quadriceps using a quadriceps table as well as the leg press, where your feet are flat on the surface and then you extend the knee joint using different weights. Thank you all for watching this video. If you have any questions or comments, you can post them below.